My name is Amy Sturkey. I am a retired pediatric physical therapist. I'm here with Jack, and Jack, you gotta look at him and let him know how handsome you are. Jack is 13 years old. He has spastic quadriplegic cerebral palsy, and he has more significant involvement. And 4 months ago, he had scoliosis surgery. So I wanted to talk about, from talking to his mom, the things that she thought about that surgery. So there are many things that are better. For one, the first thing she said is he's not throwing up as much. Before, with the curvature of his spine, actually this way and this way, it was putting a lot of pressure on his stomach, so he was throwing up weekly, just from discomfort and not being able to keep the food down. And now it's more like monthly. He still throws up when he's sick, but the frequency has cut down a whole lot. And also, he has a G-tube, and because of his posture, he was getting a lot of granulation tissue on that G-tube, and it was just staying irritated, and that is completely cleared up after surgery. Another thing is his positioning is a lot better. It used to be in his wheelchair that pillows had to be shoved in to keep him from leaning over. He actually broke an armrest because he was leaning on it so hard, and his head was able to go out and around the headrest because he was just so crunched, and then he could get his head down and around the headrest. So his positioning is just a whole lot better. The other thing is positioning in kind of recreational things. It'd gotten so before the surgery that he really wasn't comfortable anymore in his tricycle, and he loves his tricycle, and so now he can be positioned and be comfortable in the tricycle again. Additionally, you love to go on the golf cart ride, and the golf cart is something that you could not position him safely in it, and now they can put a seatbelt across him, and he is positioned fine and safe up there with somebody right beside him to make sure he's okay. But he can ride the golf cart in, and he loves it. And just simple things like that rental beach stroller that they get when they go to the beach, he could not be positioned safely in that anymore. And once again, he can be put that in there now, so that's so much better. The other thing is his arms seem not to be as stiff as they were before, and his reaching is much better, and his mobility in his arms seems better. Now his wrists are flexed, but sometimes his wrists aren't flexed anymore, so they're really seeing a difference in the positioning of his arms. Now, the things that are trickier, I think one of her biggest complaints is that his legs are much stiffer now, and it has not gotten back to the prior to surgery level. And that's something he's just now able to start standing again, so we're hoping that with that, we'll start getting some loosening up of his legs again, but his legs have been significantly stiffer. The other thing that they notice is just really holding him and picking him up and transferring him. At first, it took 2 people to transfer him because he's just so much longer than he was before, and he doesn't want to bend at his hips, so it made it harder, especially initially, that being able to transfer him. And again, that stiffness in his legs has just really persisted. The other thing that she told me is that after the surgery, it was kind of like Jack was a whole new Jack. You have an itch. There you go. Where is it that it itches? He was 4 inches taller. And when she tried to pick him up to hold him because he was uncomfortable, that he didn't bend the way he did before, and he felt like a different child, and he was in the ICU, and it was different. It was in pain, and it was jarring and alarming are the words that she used to describe it. And so she found that just hard to get used to initially, the new Jack, because he was just so dramatically different. One of the things she also said is that it took 2.5 months to get the backrest of the wheelchair all the way upright. At first, the backrest, it was like this. After surgery, they had to open up the seat to back angle because they couldn't get him bent enough, flexed up to get him into the chair. He was much more extended, and it was really hard to bend up the back. Other things that were trickier is that it was hard, like when he's laying down, now that he's longer and difficult to flex up, it's hard to get him to bend up, to get in his wheelchair, to get him out of bed, and that lack of ability to bend is really making it harder. Another thing that's tricky is he was doing horseback therapy riding before, and that particular horseback riding therapy vendor has said that they are unwilling to continue to do horseback riding with him now that he has rods in his spine. They're just worried that if he fell off the horse, that it'd just be too much of a liability and risk. And the other thing is that sitting in his wheelchair, right after surgery, it was just, because Jack can't speak, it was hard to know what was causing his discomfort. And the bottom of his incision along his back looked irritated, and she just didn't know what was causing the pain. And because he wasn't really comfortable in a lot of positions other than laying down in the wheelchair, because your incision is along your back, and obviously, and he couldn't flex up, there was a lot of pressure on his back. So it just seemed like it was difficult because it was not good positions for him to be in and feel like she could keep him out of pain. So the things that helped, she said that her husband took a week off of work, and that really helped. She does not work, so she was able to be at home with him. They have a lot of extended family. They have family that lives right next door, and that really helped them to have more support around them. His mom said that he was only in the hospital for 1 week after surgery, but he was in the ICU for the entire time. And that was partly because there was not as much availability for him to go to a regular room. And so it was not necessarily really even an option to go to a regular room, but in the ICU, he was able to have more individualized care, which she found to be really helpful for him. She also said that because we had talked about the surgery before, and as I had filmed the videos about preparing for scoliosis surgery, hearing those videos and having more education definitely helped her be able to be ready and prepared for the surgery. Also, she thinks that possibly, remember, Jack had a 70-degree curve, and post-operatively, they say that he only had a slight curve afterwards, a slight curve. They got rods for him to go after surgery, but the rods that they chose for him were not long enough because they were able to get a better correction, and he was able to get even taller. And it is possible that flexibility work, did multiple videos talking about different ways to work on that flexibility, and he's in physical therapy, that flexibility work that he'd done to his spine, we'd done with his spine before, may have really helped him to get a better correction so that he was not as uncomfortable and able to get a better correction. His mom said that having a child with cerebral palsy that's more significantly involved, typically that once they have a significant scoliosis, it continues to progress. And it's sort of like watching a slow train wreck. You can see the back starting to curve, and as he hit adolescence, it started getting worse and worse and worse. And you knew you had this big surgery coming up. And you were doing lots of, what ifs I did this, and what if I did this, and maybe I'm not doing enough of this. And to actually have had the surgery done is in some ways a relief, and to have gotten a good correction. So it feels like it's just good to have that surgery in the past. So these are the things from talking to his mom that she said about the surgery, the things that are better, the things that are worse. And I hope this is helpful. If you want more videos with Jack, click up here, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
If you like this video, please like, subscribe, or comment to help other families and therapists find this content.